So Kika, can you please explain a bit of yourself, your specialty area, where you work normally, and where are you from?
Okay, hello, I am Kika Colom. I am microbiologist, but specialized in mycology. It's my specialty. I come from the University Miguel Hernández in Alicante. I am a university professor. I teach microbiology to medical students there. And I also do my research in the field of mycology. This is my field.
Okay. And how did you hear about the project and why did you get involved?
Well, it's lovely, this question, because I heard for the first time about the project when I was attending the Congress of Medical Students in Alicante, which took place in Alicante in October. And a girl came and was explaining her experience in Turkana about the big, and she was talking about the very special incidence of Madura food in this area, and she was showing their results from the previous campaign and so on. And I'm a mycologist, and Madura food is not so common. It only happens in an area of the world, so I was quite interested in her work, and I was talking to her, and then she introduced me to this. Then I offered my experience in this field to help the group, the Turkana surgery, and I was accepted happily.
Good. What were your first impressions of the Turkana? What are your first impressions? Because you just came like 48 hours ago, so...
Yeah, it's quite recent, but my first impressions are, in one sense, excellent. People received you very, very well. They are happy to receive us. And at the same time, well, it's shocking. Many things are shocking because the tremendous difference in our health system and our sanitary care and things like that. And compared with here, and also the diseases that people show here are not, of course, like what we have there. And then I am quite impressed, but I am also quite impressed by the group, by the people in the group, because I met them for the first time 4 days ago, and it's a big mixture of different people from different specialties, and all of them look so happy being here, feeling well, able to help in a way. So it's a wonderful experience.
Okay. What is it like talking to the local people and getting to...
Okay, by now, because I am here for 4 days, there are 2 different atmospheres. In the lab, with the people in the lab, is very easy. They are very nice to me. I was welcome. I was explaining this morning my activity and so on, and they all are really nice. And it's easy to communicate because most of them speak good English, and we can very easy communication. Another thing is with the patients. Patients, most of them, they don't speak English. We need an interpreter in the middle, and they look quite shy sometimes because I think some of them, they don't know what are we going to bring to them exactly. So they look like shy, but when you do something in general, they smile and they try to understand what are we doing.
Okay. What are you doing to help to the project?
Well, I'm trying mainly to work in the problem of Madura food, which is a very specific mycological problem, and this is the main reason why I am here. But at the same time, I am here, I am a microbiologist, then I want to help all the group of surgeons who are dealing with different problems every day in the surgery theater or outside, or also for some other problems that could be infectious, and if I can help with the diagnosis or helping them to direct the treatment, then, well, I would do, of course.
Okay, the last one. Can you summarize any cases in particular that have stayed with you?
It's a very short time I'm here, And well, the first, the first important or almost complete case that I was dealing with, together with a traumatologist, was a girl who had an accident and her bone was broken 3 years ago, I think, and she had an infection in the bone, a chronic infection inside the bone, and they were operating her. I took some samples from the bone in the theater, in the surgery theater, and we could make an isolation, and now we are almost sure about which microorganism is doing this problem, and we are running now a test to know the best antibiotics to treat her. I think this is one good point.
Okay.
By now.
Okay. Thank you so much, Kika. Thank you.
You.
Bye-bye.